to understand what social prescribing is, or how we can actually help our community with it, there has to be an appreciation of what people actually come to see us for. Traditionally, everyone used to assume it was medical related issues, but there is a growing body of evidence suggesting possibly 20 to 30% of some of the problems that patients come to see us for may be actually non-medical. It could be as far as something financially related, something related to housing, something related to work, where the GP or the primary care physician probably doesn't have a good understanding of what's going on. And sadly for the patient, they may present to the doctor medicalising this, i.e. presenting with physical symptoms, or maybe having some mental health disorder that actually could be affected by the fact their situation at home is difficult. The idea of social prescribing really is to get that key link worker into our practices, possibly once, twice a week, where they could sit with this patient potentially for about 45 minutes to an hour and really get down to the nuts and bolts of what is going on with this patient, where we can help, which groups can we send them to, which community centre is available that actually suits this patient's needs. There could be a religious aspect, a cultural aspect, that maybe there is a group somewhere in Cheam or somewhere in Wellington where these patients can potentially go to and find almost like a befriending service where they get to meet patients along the same pathway, the route that they've been taking through their process in some of the issues they've been dealing with. This link worker potentially would have, say, a directory of services and a kind of a point where they could decide, right, you could go to this group on this day, but however on a Saturday they've got a walking group where you can attend. So the options are, very, very vast, and it's about Sutton getting together, forming an alliance with our voluntary sectors as well as our general practitioners to build this setup. So for the future, we could have really, in an ideal world, patients coming either to the practice or even being directed to these various groups and societies and really having better outcomes for our patients. Take NCT, National Childbirth Trust. What a wonderful example of how we can bring community together to learn and socialise for the betterment of our society and the management of our children. These groups, they form WhatsApp groups where it may be 2 a.m, for example. Mother's quite distressed, baby's crying, and basically needs some company or to have someone to run through what's going on. She normally finds, 3 or 4 of the mothers actually up at the same time for various problems with their child. But it's a great way where they can actually discuss the problems or the issues that they're dealing with their baby, rather than actually booking an appointment the next day with their GP.
My name is Irene, and I'm a patient at the James O'Riordan Centre. I have suffered in the past of anxiety and depression. However, I got a lot of help at the surgery and I was on medication. Unfortunately for me, the medication just dulled things, and I realised that perhaps there was something else that we needed to do. So when I was feeling able and better, I decided to make some investigations, and I found a CBT lady and I went to her, and that was quite good. It gave me a different perspective on things, and also she told me about a centre, St Paul's Church in Northey Avenue, Cheam. I got in contact with them and I went to their anxiety and depression. This service is completely free and is done just from the goodness of people's heart. You actually meet an array of people there, all different sorts of people from all walks of life. They also bring in people, perhaps nutritionists, maybe somebody from a CBT, or exercises. I found this very helpful, and it also gave me the opportunity to meet people in my local area that we don't seem to meet because we are in our cars, go to work, we don't see people in the community. We are very fortunate that we have the Marsden Hospital, Cancer Hospital near us. We are on a trial, or my husband's on a trial, and we go regularly. It can be quite stressful because there are times when you end up at A&E, you have a hospitalisation, all different sorts of things. Whilst there, they told me that a new Maggie Centre had opened in the grounds, which is in Cotswold Road in Sutton, where the research part of the Marsden is. It's a big red building and it's very friendly. It's a place where you can go, you can talk to people. There are people there that probably can help you psychologically. There are quiet rooms, you can go and read if you just want to be on your own. You can do yoga, they have hand massages, foot massages, art therapy, writing, all sorts of things. But most of all, there are lots of people there, and there are lots of people going through the same thing. I know that it's very difficult when people are feeling incredibly anxious or worried about their health, and it's hard to get out of the house, but it really is worth knowing about these places. And then there are walks that go on that are arranged throughout the boroughs, and people meet in parks and go walking, and I think it's all very helpful. Medicine can only do so much, and I think our social activities are probably a lot more beneficial.